Hello, everyone. I'll just take a moment to share my screen. So is my screen visible now?
Yes, it's visible.
So hi, I'm Dr. Rinkle Shah, and I would want to know who all are present here as attendees. If you could just mention your name, what you do, and where are you based from, it will be great. Then slowly we'll start. If I could just know your name, what you do, and where are you based? Anyone? Hi. I get a lot of messages. So, okay, people are here from Bangalore. Vikas from Delhi. Hello. Ankur from Bangalore. Akash from Bihar. Raghavendra from Hyderabad. Himanshu from Noida. Hello, everyone. Thank you for being here. Sahil from Karad. Nanda Kishore from Bangalore. Okay, so I think we've reached 25 of them. So a very good afternoon to all of you. I'm Dr. Rinkle Shah. I'm a BDS practicing since more than 12 years now, and born and brought up in Gujarat, practicing in Mumbai since 12 years now. I've got three babies, married obviously. One is मेरा own खून, मेरी खुद की बेटी फियाना शाह. The second one is मेरी mother-in-law का बेटा, my husband, and the third one is the most dearest baby, Ivara Dental Studio. These are some of the courses that I've been doing in the past 12 years. जगह कम था, ज़्यादा है, but I at least make it a point to attend at least one national or international dental conference every year to upgrade my skills in dentistry. Now, I want to ask you all, when do you all visit a dentist? I want you all to be very active and please reply in the chat box. I would love to see your honest replies as to when you actually visit a dentist. आप खुद से ही जाते हो या क्या होने पे आप लोग डेंटिस्ट के पास जाते हो? 2 years back, somebody says, never visited a dentist. Oh my God, I need to meet you. Anybody else? क्या करने पे डेंटिस्ट के पास जाते हो? Only if you have a problem. Yes, that's one of the very honest answers. Only when you have a problem, or let's say when somebody has a pain or a discomfort, or when we know that something has gone wrong. Otherwise, we would never ever go to a dentist. Yes, that's true. Yes, if anything happens, having problems, then only. Anybody else with some out of the box answer? क्या होने पे आप डेंटिस्ट जाते हो? Somebody who really takes the advice of 6 monthly dental visit कि कुछ हो ना हो मैं जाता हूँ. Okay, okay, that's interesting. After a fight, okay, okay. ये बहुत ही ज्यादा out of the box हो गया. People who eat a lot of chocolates, yes, definitely. Yes, I'm going to come to that, Mr. Sahil. We will definitely come. I visited 6 months back for a cavity. Somebody has had a cap. Okay, let's move ahead. Somebody says, I'm a tobacco lover. OMG. Please tell me what's the first thing that you notice in this picture? Honest answers, the first thing that comes to your mind. The first thing that comes to the mind. The first answer is missing tooth. Anybody else? Did they notice the missing tooth? The gap, right? Right. Okay. Did you all notice the missing eyebrow, my friends? दांत नहीं है, but eyebrow भी missing है. This gets us to the most important and the relevant information that 47% people first notice your smile when you enter a room or you meet somebody new. Then your eyes, smell, clothes, hair to follow. So we have to understand that smile is the most important component of your day-to-day life. Also, if you're aware that जब कोई रैंप वॉक होता है, जब कोई फैशन शो होता है, उनके जो मॉडल्स रहते हैं, उनके लिए एक रूल बनाया गया है कि आप स्माइल नहीं कर सकते हो. यू हैव टू हैव अ फर्म फेस. Only the showstopper is allowed to smile. Do you all know why? It's because जब आप स्माइल करते हो तो डिजाइनर ने जो आउटफिट बनाया है उसके ऊपर नजर जाने से पहले आपकी नजर जाती है उनके स्माइल पे. इट इज दैट इम्पॉर्टेंट. सो इसलिए ये रूल बनाया गया है. So now we know why smile is important. And so we always tell you to visit a dentist regularly to take care of that smile. Now, who thinks dental treatments are very expensive? I just want a quick yes or no. Who thinks dentists are expensive? I'm sure a lot of people have to say a yes. I think mostly everybody has to say a yes. I think whoever wants to say a yes or has already replied with a yes should watch this. So if I can have honest answers, who's done this? Have you all gone through all of this? Okay. So now this, what the video was showing in a very funny way, that एक दांत में दांत के 3 layers हैं. जब food lodgement की वजह से या because of any trauma, जब कोई cavity start होता है, अगर आप every 6 months में आप check करते हो, तो वो cavity को एक initial phase में stop किया जा सकता है. When you're just at the second or the third step, when it's not very deep, we could just do a filling. When it goes beyond that, अगर आप बीच में चेकअप के लिए नहीं गए हो और वो कैविटी मिस हो जाता है, it may go for a root canal. When you start having lot of pain, then your expenditure increases, number of sittings increase, and your pain increases. एंड देन अगर कुछ लोग ऐसे भी होते हैं कि तभी भी पेन किलर्स ले लिए, गूगल कर लिया, दवाई ले लिया, लवंग का तेल लगा लिया, और यू जस्ट टेकन अ पेन आउट और एनी ओवर द काउंटर प्रिस्क्रिप्शन फ्रॉम द मेडिकल स्टोर एंड यू डिलेड द ट्रीटमेंट, द टूथ will be completely decayed, जिसके वजह से आपको उसको निकालना पड़ेगा. And the previous video I was showing that how you will have to put an implant. Now, implant is one of the procedures to replace a missing tooth. There are other ways as well. So that is why we tell you not to avoid dental visits and not to wait for the pain to come, as a lot of people have mentioned in the chat box. You always have to keep visiting the dentist to check if there is formation of any new cavity. Now, जब आप every 6 months आते हो, तो हम करते क्या हैं? Usually, जब भी आप every 6 months आते हो, हम एक complete teeth check, gum check करते हैं. If we can see something suspicious, something new which is forming, so that it can be stopped at an initial stage. We could take a couple of x-rays if we have a doubt कि यहाँ पे कुछ तो लग रहा है, something new has come up. Or we could just do a round of cleaning and polishing. आपने बहुत सुना होगा cleaning and polishing. जो आप फोटो में देख रहे हो पीलापन जमा हो रहा है, that's because of the plaque deposit. जो एक white परत जमा होती है जब हम ब्रश नहीं करते हैं, या if you missed brushing once or twice, you will feel that a layer has formed over your tooth, which when hardens becomes this yellow colored deposit, पत्थर जैसा जमा हो जाता है, which is called tartar. So with your cleaning procedures, you get rid of all of this. So our main aim is कि ये जमा ही ना हो, ये जमा ही ना हो, इसके लिए you have to brush consistently. Brushing consistently means brushing twice in a day for 2 minutes each time, using a fluoridated toothpaste, a soft toothbrush, and with the correct brushing technique. So here I'm going to stop and just help you with the brushing technique. I'm just using a brush. This is the model of the tooth. If you could just, everybody could look here. This is the model of the tooth. This is the brush. Soft bristle toothbrush lena hai and 45 degrees angle, and we are going to brush up and down, up and down. अगर हम horizontally brush करते हैं, we can miss the junction of the tooth and the gum. ठीक है, जिसके वजह से बहुत जल्दी किनारे पे टाटर जमा हो जाता है. So what we have to do is do up and down brushing all over. After that, you have to open your mouth. We all brush on this. ये हम कोई नहीं बोलते हैं. Then we have to do this. Pull. You have to brush on the inner side of the front teeth, inner side of the lower teeth. यहाँ पे horizontal brushing नहीं होगा, आपको लगेगा, right? So हमें इसको pull करना है बाहर की तरफ. And we have to finish from the inside also. We have to clean the tongue, brush on the inner side of the tooth. See to it that हम अपने last molar tooth तक brush कर रहे हैं. कभी कभी किसी के molars, third molars, wisdom tooth जिसको बोलते हैं, बहुत टेढ़े होते हैं, बाहर से होते हैं, ब्रश पहुंचता नहीं है, यहाँ हम कोशिश करते हैं, तो what happens is it hits our jaw, right? So what we have to do is open the mouth a little, adjust it, or you have to turn and put it till the end of the tooth. You have to see that all the sides of the teeth are covered. Okay. So brushing is very important with a soft toothbrush and 2 minutes each. And then you have to clean your tongue. So this is with the brushing. Now, a lot of people will say if mouthwash does the trick. Okay. So mouthwash is not a replacement of your routine brushing. It's an add-on. Okay. A lot of people do this mistake, especially I've seen it in my practice, that आप brush तो कर लेते हो, तुरंत से mouthwash करोगे. Brush, toothpaste में जो ingredients हैं, almost similar ingredients हैं mouthwash में. Why use both at the same time? So आप सुबह में brush करके निकल रहे हो, तुरंत से माउथ वॉश यूज नहीं करना है. यू यूज इट ड्यूरिंग द डे. इफ यू हैड समथिंग सम काइंड ऑफ फूड जिसकी वजह से आपको लगता है कि बैड ब्रेथ है, यू कैन यूज द माउथ वॉश एट दैट टाइम. डू नॉट क्लब बोथ ऑफ दीज. व्हाट काइंड ऑफ माउथ वॉश टू यूज? बहुत आर्टिकल्स लिखे गए हैं, but my suggestion to you will be any non-alcoholic mouthwash. Alcoholic doesn't do the trick, ऐसा नहीं है, but lot of alcoholic mouthwashes have पिगमेंट्स, कलर पिगमेंट्स, जो रेगुलर यूज के वजह से किसी किसी को स्टेनिंग होता है. एंड प्लस अल्कोहलिक माउथ वॉशेस से किसी किसी को सेंसिटिविटी होता है, राइट, रेगुलर यूज पे. तो हम नॉन अल्कोहलिक माउथ वॉशेस प्रेफर करेंगे. मिनिमल क्वांटिटी, स्ट्रॉन्ग लग रहा है तो 1:1 डाइल्यूशन इज ओके, once in a time, but not immediately after brushing, because they both do the same job. Same job meaning इसका ये मतलब नहीं है कि सुबह में ब्रश किया और रात को माउथ वॉश किया एंड इट इज ओके. इट इज नॉट ओके. ओके. सो ब्रशिंग सुबह और शाम करना ही है. माउथ वॉश इज एन एड ऑन बिकॉज ऑफ द काइंड ऑफ डाइट दैट वी हैव दीज डेज. वी ईट बेसिकली आउट ऑफ द पैकेट्स. चिप्स ले लिया, बिस्किट्स ले लिया, रेडी टू ईट फूड हो गया. ऑल दैट हैज लॉट ऑफ प्रिजर्वेटिव्स एंड शुगर कंटेंट. पहले हम ऐसा सब नहीं खाते थे, इसलिए दांत पे जो व्हाइट लेयर जमा होता है, बायोफिल्म दैट वी कॉल एज डेंटिस्ट, और प्लाक दैट यू ऑल विल कॉल, ज्यादा जमा होने लगा है. तो उसको निकालने के लिए ये सब एड ऑन्स हैं. ओके. तो क्लीनिंग विल टेक केयर ऑफ ऑल ऑफ दीज थिंग्स. ऑल्सो क्लीनिंग का प्लस पॉइंट ये है, लुक्स भी सुधारेगा. लॉट ऑफ पीपल हु डोंट ब्रश वेल, आगे के दांतों में बहुत पीलापन जमा होता है, बैड ब्रेथ होता है, एंड दिखने में भी अच्छा नहीं लगता. सो इट विल इंप्रूव योर कॉन्फिडेंस, माउथ ब्रेथ, एंड योर ओवरऑल हेल्थ. हाउ? आई विल टेल यू इन द नेक्स्ट कमिंग स्लाइड्स हाउ क्लीनिंग हेल्प्स. So now this is the main thing. Now अगर हमने आपने चेकअप कराया और यू रिमेम्बर द स्टेजेस वेयर आई शोड यू कि दांत पहले कैविटी हुआ, जब हमने फिल नहीं किया, रूट कनाल भी नहीं कराया और पूरा ही खराब हो गया, निकालना पड़ा. अगर दांत निकालना पड़ा और आपने वापस नया दांत नहीं बिठाया है, देन व्हाट हैपेंस इन द रियल लाइफ? लेट मी शो यू. This is what actually happens in the patient's mouth. This doesn't happen overnight. It happens over a few years, and you may not realize that this is happening in your mouth. Okay, so एक दांत नहीं है, जैसे ही नीचे का दांत गया, धीरे धीरे आजू बाजू के दांत टिल्ट होने लगते हैं, ऊपर का दांत नीचे आने लगता है, एंड वो तीनों दांत चेंज रिलेशंस विद देयर एडजेसेंट टीथ, एंड वो सब जगहों पे कैविटी स्टार्ट होती है. ये तुरंत नहीं होगा, ये डे टू डे प्रैक्टिस में देखा जाता है, ये होता ही है, बट इट जस्ट द टाइमलाइन कैन डिफर. So that is why we keep telling you that you have to go to the dentist, get all of this checked, and replace your missing tooth and get the treatments done. अगर ऐसा कोई मिसिंग टीथ है, तो जैसे मैंने आपको बताया कि हम उसको रिप्लेस कर सकते हैं. वेरियस ऑप्शंस. द बेस्ट वन इज एन इम्प्लांट. Again, there are a lot of things to be checked before putting an implant. In very simple terms, implants is a titanium screw placed inside the bone, and over that a tooth is given. उसके लिए आपको आपका health checkups भी कराना पड़ता है, and the doctor, the dentist will help you if you are a perfect candidate for an implant. If not, there are various other options as well. Then there's something which is called the invisible braces. It's something to get your teeth aligned. अगर जो आपने वीडियो में देखा, दांत धीरे धीरे टर्न हो रहे हैं, अभी तक कैविटी स्टार्ट नहीं हुए हैं एडजेसेंट टीथ में, एंड यू आर ऑन टाइम, यू गो टू द डेंटिस्ट, यू कैन जस्ट स्ट्रेटन दोस टीथ. जो ऊपर वाला दांत नीचे आ रहा था हम उसको ऊपर ले सकते हैं, जो दांत टिल्ट हो रहे थे हम उनको सीधा कर सकते हैं एंड सिर्फ बीच में दांत बिठा सकते हैं. All of it can be done through braces. Here, as a representation, I've shown you invisible braces, but there are other kinds of braces as well. As and when required, we could talk about that. Then there's something called as a smile makeover. आपने बहुत कुछ देखा होगा, Insta, social media, celebs, all of these keep doing it. So whenever smile makeover, ये आपको मैंने एक ड्रास्टिक पिक्चर दिखाया कि दांत कैसे थे और हमने कैसे कर दिए. But as simple as doing a complete cleanup, a teeth whitening, or a normal filling could also be a part of smile makeovers. So this is just the jargons that I've tried to solve. हर बार जरूरी नहीं है you do lakhs of treatments to get something corrected. Sometimes a simple cleaning and a filling or a tooth whitening could also do the trick and improve your smile. So all this I've told you is for you to understand that dentistry is not expensive. It becomes expensive only when you neglect it. अगर पहले ही उसको ठीक कर लो, जब पहले कुछ नया स्टार्ट हुआ, तो डेंटिस्ट्री एक्सपेंसिव नहीं है. जब आप स्टार्टिंग में एवरी 6 मंथ्स यू विजिट अ डेंटिस्ट एंड स्लोली यू कीप अ चेक कि कोई नया कैविटी फॉर्म हो रहा है या नहीं, कैविटी फिलिंग इज लेस एक्सपेंसिव, लेस टाइम कंज्यूमिंग एंड आपको भी कोई तकलीफ नहीं होता है. एज जितना कैविटी डीप होगा, जितना प्रॉब्लम बढ़ेगा, आपका पैसा, टाइम, एनर्जी भी उतना हो जाएगा. So please do not neglect your teeth. I also want to emphasize on why some other systemic illness that could happen if you neglect your teeth. A lot of us in India and all over, we are straight in front of the cameras, the laptops and the screens all the time, working from one chair, and you have a lot of stress. So stress, tension, this joint, TMJ joint, isko bolte hain, it is affected, and slowly the TMJ joint obviously is connected to your teeth. ठीक है. तो आप जब स्ट्रेस में हो, टेंशन में हो, यू स्टार्ट ब्रक्सिज्म मतलब आप दांत घिसते हो रात में, क्लेंच करते हो, गुस्सा आता है, ऑल दोस थिंग्स स्टार्ट टू अफेक्ट योर आईज, your jaws, your neck muscles, your ear pain, and they affect your teeth. So a regular dental checkup will help you keep all these things in check. Whenever you have an issue with the TMJ, all your facial muscles start to hurt. Okay, all your facial muscles, the temporal muscles over here, they start to hurt. So it's a very good check, and all this can be diagnosed right on time. There are remedies to solve this issue. So please visit a dentist on time. Also, if one is pregnant, okay, there is a huge correlation between pregnancy and your oral care. The statistics say that agar mother has lot of cavities, the child is prone to have lot of cavities. Also, because of the hormonal changes and the changes in the eating habits, if the mother did not have cavities before she conceived, but during her pregnancy, high chances of her getting new cavities or developing a lot of tartar or swollen gums. I have faced this myself. So please do not neglect it. What you need to do is the first trimester, meaning the first 3 months are not that safe, neither are the last 3 months. Having said that, ऐसा नहीं है कि during those 9 months you cannot visit the dentist. You could do, but there are few restrictions on taking the X-rays and certain kinds of treatments. But basic treatments could be done. And the best phase to get any kind of dental treatments done safely is the second trimester. So make it a point, whether you have an issue or you do not have an issue, you have to see the dentist in your second trimester. Please inform this to your friends, family, or whoever is in your circle and who's expecting. Also, I was talking about cleaning. Now, how the oral cavity is connected to your lungs. Now, we all know of pneumonia. Pneumonia, in a very short description, is the inflammation of your lungs, your air sacs, jidhar up, the way you breathe, right? The inflammation in your lungs. Now, if your mouth has lot of cavities or deposits, calculus, your oral hygiene is not that great, the bacteria, the microorganisms travel through your pharynx, मतलब हवा की नली, right? उससे travel करके they reach your lungs and they are capable of causing that inflammation. And the statistics say that people with very poor oral hygiene are too much prone to pneumonia. So a simple cleaning could do the trick if you have constant cough and cold. Do not neglect this. There's a huge correlation with diabetes and your oral health also. Sometimes जिनके cases में diabetes undetected है अभी तक, but कभी कभी ऐसा होता है कि हम आपके gums देख के बता सकते हैं कि आपने अपना आपका शुगर चेक कराया क्या, आपको शुगर हो सकता है, और हम यहाँ से भेजते हैं और समझ में आता है कि द पर्सन हैज हाई डायबिटीज. The reason why we can know is there are a lot of fungal infections that happen in the mouth when the person has got high diabetes. The amount of decay increases multifold when somebody has diabetes. The gum disease मतलब पेड़ों की तकलीफ भी बढ़ जाती है. Some people may have delayed healing, say have removed a tooth लेकिन दांत वहां पे healing ही नहीं हो रहा है. All that signifies or points out towards high diabetes. अब डायबिटीज और दांत का एक्चुअल कोरिलेशन ये है कि जब डायबिटीज होता है हीलिंग ही नहीं होता है, आपके ब्लड में शुगर कंटेंट ज्यादा है, उसके वजह से सलाइवा में भी शुगर कंटेंट ज्यादा हो जाता है, and that is why your teeth will start have deposits, and if your oral hygiene is not that great, your teeth will start having lot of new cavities and your gums will start swelling. Also a very good way of controlling your diabetes, क्या जो correlation पाया गया है कि जिनका डायबिटीज कुछ भी करो कंट्रोल में ही नहीं आता है, उसका भी एक स्टडी हुआ था कि क्यों कंट्रोल में नहीं आ रहा है. मोस्ट ऑफ देम में एक मिसिंग टूथ पाया गया है. नाउ टू अंडरस्टैंड, जब द डायबिटीज इज ऑफ टू टाइप्स. वन जो हार्मोनली प्रॉब्लम होता है, टाइप 1 डायबिटीज, पर वो इतना कॉमन भी नहीं. टाइप 2 इज बिकॉज ऑफ योर लाइफस्टाइल दैट यू हैव शुगर जो कंट्रोल में नहीं. तो अगर शुगर टाइप 2 डायबिटीज है तो देन योर डॉक्टर विल गिव यू मेडिकेशन, दैट्स द फर्स्ट एंड फॉरमोस्ट थिंग. अदर देन दैट ही विल टेल यू टू डू सेल्फ केयर, लाइफस्टाइल मॉडिफिकेशन. अब लाइफस्टाइल मॉडिफिकेशन में ये होता है कि आइदर दे विल टेल यू टू वॉक एंड कंट्रोल ऑन योर डाइट. जब डाइट कंट्रोल की बात आती है, दे विल टेल यू टू ईट बाजरा रोटी, नाचनी रोटी, एक्स वाई जेड थिंग्स, सैलेड्स. अब ये सब चबाने के लिए यू नीड गुड टीथ. ठीक है, अगर बिस्किट खाना है, चिप्स खाना है, कुकीज खाना है, केक खाना है, तो चबाने की जरूरत नहीं पड़ती है. बट व्हेन यू हैव टू ईट ऑन अ बाजरा रोटी, नाचनी रोटी, और यू हैव टू ईट ऑन सैलेड्स, you need strength in your teeth, otherwise jaw muscles will start hurting. जिनके पास पीछे के missing teeth है, they will always choose softer things to eat which are either overly cooked or out of the packets. तो आपका लाइफस्टाइल मॉडिफिकेशन काम नहीं करता है और आपका शुगर कंट्रोल नहीं होता. There are a lot of diabetes specialists who actually send patients to us saying that कि ये डाइट फॉलो नहीं कर रहे हैं, उनको पीछे के दांत बिठा के दो. So there's a huge, in this way, there's a huge correlation in diabetes and your oral health. The same way, there's a lot of correlation with your gum health and osteoporosis. Osteoporosis is a disease affecting your bones. तो जैसा मुंह में हड्डी है, हड्डी के ऊपर you have your gums and your teeth. If the bone is depleting, your teeth will start moving. So for a stronger tooth, you need to eat good and you have to take care of all of these symptoms. Lot of correlation with Alzheimer's and dental this thing also, because Alzheimer's के patient में एक particular kind of bacteria मिलता है which causes gum disease and infections. So in those patients also oral hygiene should be taken care of. Do we have any questions till now? Am I going too fast? Or you want me to go ahead? If anybody could tell me in the chat box, do you have any questions till now? Because we finished one kind of segment. Okay. Okay, we could answer it later. So I'm just asking if it's pertaining to any particular disease that I've spoken to right now, or else we can take the questions later on. No problem. Okay. So commonly seen cases now. 1 minute. Yes. So this, if you know, if you heard of wisdom tooth या अक्कल की दाढ़, this picture shows us that विजडम टूथ कभी कभी सीधा आता है, कभी टेढ़ा आता है. अगर टेढ़ा आता है निकालना पड़ेगा, लेकिन बहुत लोग बोलते हैं कि अक्कलदाढ़ नहीं निकालनी चाहिए. अक्कलदाढ़ निकालने से क्या होता है? फुल टेल मी, क्या होता है अक्कलदाढ़ निकालने से? व्हाट इज द मिथ अराउंड दिस थिंग? Any myths that you all have heard regarding the अक्कल की दाढ़? Memory loss, right? Even I have heard of that. Anything else? Guys, reply. दांत निकालने से अक्कल की दाढ़ क्या होता है? अक्कल की दाढ़ निकालने से yes, I was waiting for this answer. Impact on an eye, memory loss or impact on an eye. Yes. So these both are myths. I want to throw light on this. ऐसा कुछ नहीं होता है. जिनके एक भी दांत नहीं है वो लोग भी देख सकते हैं. They can see. It's a myth. The nerves that supply to your teeth and the nerves that supply to your brain or the eyes are completely different. They run very near to each other, but they are not interconnected. So अगर हम अक्ल की दाढ़ निकालते हैं, ऐसा कुछ भी नहीं होता है. ओके. ओनली थिंग, हम अक्ल की दाढ़ कब निकालते हैं? अगर टेढ़ी है. टेढ़ी है तो क्या होता है? वो आगे के दांत को धक्का मारती है, या फिर पीछे का दांत या अक्ल दांत टेढ़ी है, आगे का सीधा है, बीच में इधर खाना फंसता है, एंड उसके वजह से इस पे भी पेन होता है और ये अच्छे दांत को भी तकलीफ हो जाती है. इसलिए जब भी अक्ल दाढ़ टेढ़ी होती है एंड इट स्टार्ट्स टू हर्ट, वी टेल यू टू रिमूव इट. अब वो निकालने के अलग अलग प्रोसीजर्स होते हैं डिपेंडिंग ऑन योर प्रॉब्लम. द डॉक्टर विल हेल्प यू आउट. बट अक्ल दाढ़ निकालना इफ रिक्वायर्ड इज कंप्लीटली सेफ. This is a picture of around 3 to 4 years old kid, and उनका ट्रीटमेंट नहीं कराया गया है. If anybody knows what is the myth, if you could help me, what is the myth around या हम क्यों नहीं कराते बच्चों का ट्रीटमेंट? If can somebody can help me with it in the chat box. क्यों हम बच्चों के दांत का ट्रीटमेंट नहीं कराते? Guys, time is pressing. Please, if you could help me. मिल्क टीथ है, यस. बट ट्रीटमेंट क्यों नहीं कराते मिल्क टीथ है तो? As they are going to fall after age and will regrow, right? But do you know that सारे मिल्क टूथ तुरंत नहीं गिरते हैं? They go on for the age of around 12 to 13 years. अगर 3 या 4 साल की उम्र में बच्चे को तकलीफ हो गई है, पेन हो रहा है, और वो दांत आपका गिरने वाला है 13 साल की उम्र में, डू यू थिंक ये बोल के कि 10 साल में गिरने वाला है आप उसको ट्रीट नहीं कराओगे? इट इज रॉन्ग. Also, if the tooth has cavity, it is staying, the bacteria travel, उसके ही नीचे आपका permanent tooth है. It affects the permanent tooth, not just below it. Sometimes आगे के दांत आपके 6 years के 7 years के एज में गिर रहे हैं, बट ये बाजू वाला दांत आपका वही है जिसमें कैविटी है, और ये नया आ गया है और इसमें कैविटी है. डू यू थिंक इन द नेक्स्ट 10 years जो वो बाजू में ये वाला दांत भी है और साइड में भी है, यहाँ से यहाँ कैविटी ट्रैवल करके आपके नए दांतों को अफेक्ट नहीं करेगा? मोस्ट ऑफ द केसेस में करता है. तो वेरी इंपॉर्टेंट दैट वी डू नॉट निग्लेक्ट किड्स टीथ का ट्रीटमेंट. इट इज वेरी इंपॉर्टेंट. नॉट जस्ट दैट, if बच्चों के दांत का ट्रीटमेंट नहीं किया जाता है, आगे के दांत का स्पेशली टाइम पे, और वो बेवक्त गिर जाते हैं, तो आपके नए दांत टेढ़े मेढ़े आते हैं। वन थिंग ऑल्सो, इफ दे आर फुल ऑफ कैविटीज और ये खराब हो गए, सब में होल्स हो गए, व्हेन बच्चा बोलता है आपको एक तोतला आवाज आएगा, दे विल नॉट बी एबल टू टॉक कॉन्फिडेंटली. That is because the air passes away. Front teeth are not in the correct shape. So it affects your child's nutrition and confidence, both of it. So very important that we do not neglect any kind of treatment that is required for our kids. This is a case that I had done. We've just done simple 4 fillings for this kid, and we've regained the confidence back. Right? So kids dentistry is also possible and very important. Now this is another case. जो ऊपर का आप देख रहे हो कैविटी है, दिस केस मैंने ये दिखाने के लिए नहीं लिया है कि मैंने कितना अच्छे से उनका लुक्स इंप्रूव किया. आई वांट टू एम्फसाइज ऑन व्हाई डिड दिस कैविटी हैपन. ये कैविटी अंदर से स्टार्ट हुई थी, क्योंकि अंदर से जो मैंने आपको ब्रशिंग टेक्निक दिखाया, ब्रशिंग टेक्निक जिसमें आई टोल्ड यू कि अंदर से ये एरिया में ब्रशिंग करना है, आप यहां से ब्रश करते हो, ये करते हो, अगर इफ यू फॉरगेट दिस पार्ट, तब ये काइंड का कैविटी होता है. सो वेरी इंपॉर्टेंट दैट वी ब्रश फ्रॉम द इनर साइड एज वेल. Also, this is one of the cosmetic cases. This cavity had also started from the inner side, so very important that we brush from the inside of the top teeth and the bottom teeth. Now this case is, सामने के दो दांतों में हमने एक विनियर दिया है फॉर द स्माइल करेक्शन. पेशेंट वाज नॉट हैप्पी विद द स्माइल, बट अदर देन द स्माइल मेकओवर, आई वांट यू टू अंडरस्टैंड व्हाई डिड दिस हैपन. ये सामने के दांत नीचे से अचानक इतने पतले और ऐसे वोन आउट क्यों हो गए? इट इज बिकॉज पेशेंट को ब्रक्सिज्म का हैबिट था. टेंशन स्ट्रेस में द पेशेंट यूज्ड टू क्लेंच टीथ एंड ग्राइंड हिज और हर टीथ. That is why this problem arises. For cosmetic reasons, we have given him a veneer, but we also have to eliminate the cause, and for that, we have given him a night guard. So all this only a dentist will be able to help you. We also do the times are moving. We do a lot of metal free dentistry. पहले सिर्फ सिल्वर के कैप्स आते थे, फिर मेटल के और सिरेमिक कॉम्बिनेशन के कैप्स आते हैं, और अभी कंप्लीट सिरेमिक के कैप्स आते हैं. As and when required, your dentist will help you for that. And there's something called as implant, जिसके बारे में मैंने पहले बताया. तो एक मिसिंग टूथ था, यहाँ पे हमने आजू बाजू के दांतों को टच किए बिना एग्जैक्टली जहाँ प्रॉब्लम है वहां वी रिप्लेस्ड अ टूथ. This is very important. Also, if you have got a lot of missing tooth in the back, especially the females, after a few years, you will see flaring of the front teeth. Flaring of the front teeth meaning धीरे धीरे आगे के दांत आगे आने लगते हैं और गैप होने लगता है. It is always because पीछे के दांत नहीं है, पूरा वजन आगे के दांतों पे आ रहा है खाने के लिए. That is when it happens. So very important that you replace your missing teeth on time. This is a case wherein we've done a cosmetic filling 1 day procedure for the front tooth. So all this is possible, all this is painless completely, and when done on time, doesn't cost you much. These are the kind of services that we offer. All good practices will offer all of these services. How do you choose your dentist? What sets us apart? Or how will you choose? What do you have to see कि मैं ये dentist के पास जाऊं या ये dentist के पास जाऊं? या one dentist is charging higher, other one is comparatively cheaper. I'm not saying anybody is bad, but the cost that goes to give you that kind of service matters. Now, whoever is following a very strict sterilization protocol will have higher expenses, and but they ensure your safety. So any good practice, including ours, follow this 6-step sterilization protocol, wherein after use, all instruments are first washed with soap and water, after which they are dried and put for a chemical sterilization, because a lot of viruses cannot be just killed with one step of sterilization. We have to follow 2 steps of sterilization. ओके, सो हम एक केमिकल में डाल के उनको सोक करते हैं. उसके बाद टू गेट रिड ऑफ द केमिकल्स ऑन द इंस्ट्रूमेंट्स दे पुट देम इनटू एन अल्ट्रासोनिक स्केलर, जिसमें से आपका जो भी केमिकल स्टक हुआ है इंस्ट्रूमेंट्स पे वो निकल जाता है. उसमें क्लीन करने के बाद वी कीप इट फॉर ड्राइंग, देन वी पैक इट एंड देन वी पुट इट इनटू ऑटोक्लेव मशीन, जहां पे वो स्टरलाइज होके दे आर पुट इनटू द ड्रॉवर्स टू बी यूज्ड फॉर द नेक्स्ट पेशेंट. Whoever follows this will have a high cost involved, but that sets a dentist apart, and you should go for people who follow all of this. Okay, this is just the video of my practice where we take care of our patients like our family. We are open to questions now. Please write them in your chat box, and I would be happy to help you out. Any questions? Is oil pulling method helpful? Frankly, not tried myself. I am done with the toothpaste, toothbrush, flossing, mouthwash. It's too much enough for myself. I have not been able to try that. Powder versus paste, always paste. Not tried the powder myself, but if the powder, a lot of powders, what I have read is the size of the powder, the granules, they cause a lot of friction. That is why a toothpaste is always better. So bad breathing after brushing twice a day with proper practice and mouthwash regularly. Then you have to check your systemic conditions. You also have to check your gut health, your acidity issue, and your water intake or any deficiency. If you're brushing well with your mouthwash, tongue cleaning, then it's either your systemic illness that is causing the bad breath. Electric toothbrushes are very much safe. There are a variety of them available in the market these days. I'll just briefly tell you about two kinds of majorly how the electric toothbrushes are divided. One is a routine electronic toothbrush and one is a sonic toothbrush. Now, electric toothbrush के rotations per minute कम है and sonic toothbrushes के rotations ज़्यादा हैं. They equal to the teeth cleaning, professional teeth cleaning that we do in our clinics. So obviously they are a little more expensive, the sonic toothbrushes, but they do their job very well. Having said that, electric toothbrushes, routine electronic toothbrushes बुरे हैं ऐसा मैं नहीं बोल रही हूँ. Also, it means that normal toothbrushing also does the trick. You just have to do it with the correct technique. Now, when you use a sonic toothbrush, the advantage is the number of visits to the dentist and the findings that you have at the dentist after every 6 months when you go, they are very less. Okay, so it almost does the job of the cleaning. So आपके plaque and tartar deposits will be almost negligible when you use sonic toothbrushes because of the rotations, the speed, the way it cleans. What precautions could we take for kids under 10 years of age? Healthy eating, include everything जो हमारी दादी नानी बनाती थी. That's it. No eating out of the packets. If you are eating a balanced diet, जो भी आप जहां से belong करते हो वहां पे जो हमारे पूर्वज खाते थे, अगर आप वो खाते हो, if you are including all your proteins, carbohydrates, etc., in your meals, everything is taken care of. The body takes care. You don't need any extra supplements until and unless advised by the doctor because of your medical condition. Can teeth discoloration be solved without artificial treatments? Now, that depends upon what kind of discoloration it is. If it is because of the high fluoride content in the water or calcium deposits, the white spots that are inside the tooth, when वो तभी से है, birth से है या 6 years के age से है, that is because either of the genetics or because of the water content when you were growing up. All those things cannot be cleaned or treated without an artificial treatment. Artificial treatment meaning as simple as fillings can do the job. तो वो सब नहीं होंगे. अगर deposits हैं, plaque deposits है because of smoking, your wine or alcohol, या hookah or your curries, gravies, food colors, all those things could be just treated with your normal cleaning. Are fluoride-based toothpaste safe over long term? Fluoride-based toothpaste are compulsory. Okay. So the fluoride-based toothpaste are compulsory. No negotiations with that. Agar if your kid is small, meaning a toddler, 3 years, 2 years age, जब से पहला दांत आता है तब से आपको ब्रश करना है. तब आप एक राइस ग्रेन जितना टूथपेस्ट लेंगे बच्चे के लिए, उतना टूथपेस्ट ठीक है, फ्लोराइड वाला ही. ठीक है, बिकॉज उतने टूथपेस्ट में उतना ही फ्लोराइड कंटेंट है जो अगर बच्चा निगल गया देन ऑल्सो इट विल नॉट कॉज एनी सिस्टमिक प्रॉब्लम. इफ योर क्वांटिटी ऑफ टूथपेस्ट इज नॉट करेक्ट then it will create a problem. For adolescents, meaning around 6, 7 years, 8 years, से आपका 10, 15 years तक, you have to take एक मूंग के दाने जितना toothpaste, and over that एक चने के दाने जितना या छोले के दाने जितना. Okay, so the amount of that for us adults it is छोले के दाने जितना. उससे ज्यादा पूरा टूथपेस्ट भर दिया आपने टूथपेस्ट से, not required, wastage of resources, and it doesn't help, doesn't add on, so not required. So fluoride based toothpastes are compulsory, but the trick is how much you use. तो ads में, Colgate में आपको दिखाएंगे पूरा पूरा brush head. This full brush head has to be covered क्योंकि उनको ज्यादा टूथपेस्ट बेचना. Okay, it's not required. Okay, my kid is having very slow growth of teeth, so growth can vary. If it is too late, usually 5, 6 years के age तक आपके permanent दांत आना शुरू हो जाते हैं, plus or minus 1.5 year is okay. अगर उससे भी ज्यादा है तो ऐसा नहीं है कि ऐसा नहीं हो सकता है. You have to get a full mouth X-ray done to check if the teeth are forming inside. There could be a delayed eruption. It is quite possible, especially we are seeing all of this in the current scenario. But you can just cross check, तो आपको भी एक तसल्ली हो जाए. Many times certain areas inside the mouth are unreachable by the toothbrush. That's what I'm saying. The most unreachable area is the wisdom tooth, the back side. Okay, you have to tilt your brush, try and use it. ओके तो अगर आप आ करके पीछे तक नहीं जा सकते हो क्योंकि वो जॉ को हिट कर रहा है, आप थोड़ा मुंह बंद करो, एडजस्ट द हाइट, पुट इट एंड यू हैव टू क्लीन इट. The highest amount of cavity is found on the last tooth, जहां तक ब्रश नहीं पहुंचता. अगर उसके बाद भी you feel it is very uncomfortable, keep getting your cleanups done ताकि the doctor will be able to help you clean your last tooth completely. And also if there's a cavity which is forming, तो आपको अक्कलदार से आगे वाले दांत में ना जाए उसके लिए क्या करना चाहिए, तो डॉक्टर will be able to help. So good brands. I've recently used something called as Seven Oral Care. I'm using it. It's a luxury brand. It's a good brand. I think it does the job well, but I think I'm still, trying various brands. So I'll not be able to help you with the best one yet because I have to choose after using everything, right? All the kind of brushes that are available in the market. Can we use implants for a person whose age is more than 60 years? Yes, if medically fit. Implants were initially designed for people for geriatric cases, meaning people who are above, say, 50 or 60 years of age, and slowly they've been brought to use for young patients. So if you're medically fit, sound, if there's enough bone quality, we can do implants. In fact, if you have a good hygiene, you will need implants only after that age. Our idea is to do preventive dentistry कि पहले तो आपका ओरिजिनल दांत खराब ही नहीं होना चाहिए. And in spite of that, अगर खराब होता है because of the usage, wear and tear, it has to happen in your old age. So old age में, then again there should be two options, either dentures or implants. Obviously, implants always win with the comfort, patient comfort. Any good dental teeth clinic in Bangalore? Sorry, friend, I will not be able to help you with that. I have no connects in Bangalore. How often floss should be done? Can kids also use this? Now, kids who have got all their permanent teeth on, meaning after the age of 13 or 14, जब तक आपके सारे दांत आ जाते हैं, then yes. उससे छोटे बच्चों के दांत में गैप्स नेचुरली होते हैं, फ्लॉस का कोई मतलब नहीं है, जस्ट ब्रशिंग विल डू द ट्रिक. And for adults or say anybody above 13 to 14 years of age, we could do flossing. I will help you with different kinds of flosses as well. So say this is the model, the kind of floss that I have. There are two varieties of floss. Just, you know, take little, wind it around your finger, and you have to pass it from your tooth. Okay, I'll just help you. I don't know if you'll be able to see. You have to do like this. Okay, so go inside and come back out. Just wind it around your finger like this. Okay, तो आपको पीछे तक भी जाना है, आगे भी जाना है. All that you have to do. There's another kind of floss that is available in the market. For beginners, you could use this. It's readily available with the chemist. It's a one-time use. You go inside, come back out. Okay, push pull. One time use. एक बार use करने पे I think I don't use it regularly. I use a routine floss only. But this is a good thing for the beginners. Are steel tongue cleaners safe? They are very much safe. In fact, they are the ones actually used. We have to be practical. Plastic tongue cleaners are not good for us and not good for our world as well. So, yes, I prefer any kind of metal tongue cleaners over plastic. Having said that, plastic काम नहीं करता है, ऐसा नहीं है. Okay. Sorry, I will not be able to help. Opinion for on mewing for face structure. I'm not aware of this. If you could just help me with this, if you can explain in detail. Oral-B sonic toothbrush. Yes, you could use it. Oral-B is a good brand. I think that's it for now.
I think we have no more questions, right? Okay, so we can end the webinar, right? Thank you so
Yeah.
much, Dr. Rinkle, for the session. Like, thank you so much. And thank you all once
I just
again.
want to share this screen. If
Sure,
anybody
sure. Please do that.
from Bombay, they could avail this offer. It's an exclusive offer valid till the end of this year. If you've attended the IMT Care seminar with Ivara Dental Studio, you're most welcome to have a dental consultation, you and your family, at our studio based in Khar West. And we have special offers lined up for you. You can please feel free to get in touch with me on my Instagram handle. And if you liked today's seminar, please subscribe to our Instagram page. I will see how many people subscribe, and accordingly, I know whether you had some takeaway from today's session.
Thank you. Thank you, Dr. Rinkle. Thank you for the session and thank you for the offer. So thank you all once again and have a wonderful day ahead.
Thanks a lot. Bye bye.
Thank you. Bye-bye. Take care.